Well, welcome everyone to our special presentation on the GreenSurance Advantage. I'm your host, Virginia Parsons. I'm known as the Hangout Mentor, and I am the founder of Hangout Marketing University. And I can help you, the healthcare provider, establish yourself as a recognized authority and grow your patient base and your following using this remarkable technology, Hangouts on Air. You can get more information on my services at hangoutmarketingu.com, which you can see right below us here. Now listen, you are in for a real treat today. You will be getting a detailed overview of the GreenSurance Advantage from Kari Gray, its CEO and founder. So if you're an alternative healthcare provider, you're in the right place at the right time. Today, GreenSurance is an alternative therapies co-op initiative for health coverage. And Kari's going to explain the GreenSurance Advantage today for all of you and answer any questions that you might have. Now, I also want to welcome Clara Weisner. She is the owner and founder of Revolutionary Lifestyle and is a functional nutritionist and transformative health coach. She is the newest member of the advisory team of GreenSurance and leads the Give Back program GreenSurance is now developing. So come on in, Clara, first, and unmute yourself and say hi to our audience, won't you?
Hi, everybody. I'm Clara Wisner, owner and founder of Revolutionary Lifestyle. And I really envision a world where people view self-care as the foundational thing to all other successes in life. And that's really where I try and work and where I try and come from. And I found GreenSurance because I am interested in always giving back. And I thought that they looked like a great opportunity to get more people involved in alternative healthcare, because if there's insurance involved, then more people have access to it. And I really believe in creating options and letting people know that they have options. And so that's kind of how I got involved in GreenSurance, and I really believe in alternative healthcare, especially nutrition, as a means to vibrant health and happiness. So thank you for having me, and look forward to teaching you guys more.
Fantastic. Thank you so much Clara, for letting people know why you're so passionate about GreenSurance. And now we've got the founder and CEO herself, Kari Gray, here to talk to you from her heart and soul about why she started GreenSurance and to give you a good overview on what GreenSurance could mean to you, the healthcare provider. So come on in and say hi, Kari.
Aloha from Hawaii, everyone. Thank you for joining us. It's such an honor and a pleasure to know that you have taken a moment of your valuable time, and we promise the information that we share today is going to be worth the investment you've made in listening to what we have to say. You see, we believe that in order to have a successful healthcare plan, it has to work for everyone. It has to work for the patient, and it has to work for the provider. And today you're going to find out how that is coming to fruition. So stay tuned. Information's coming very soon.
Thank you, Kari. I know I've heard this presentation before, and every time I hear it, I just get more excited about what you have formulated, because this is so innovative and it's so win-win, not just for the healthcare provider, but for all the people out there who want to take advantage of alternative healthcare but may not have the financial means because in the past they've always had to pay for it out of their own hard-earned pockets. So we're going to let you go ahead and set up the PowerPoint and get ready to share that, because I know you really want to give people the information with some visuals. So you can take notes, plan to take notes from Kari, and she's going to be off stage while she does the presentation, but she's going to be there in the background, and we'll all be I'll be monitoring to see if you have questions. So down below in the event page, there's a place for you to type in your questions. We want to hear from you. We'd love to know where you're hanging out from. I happen to be hanging out from Reno, Nevada, on a very warm but smoky day here with all of the fires, unfortunately, in the western states. And I know Clara right now is hanging out from Montana. And so isn't this the beauty of doing Hangouts anywhere? We can reach you, and Kari from Hawaii, we can reach you really virtually anywhere. So let us know where you're hanging out from in the comment section, and know that that's where you can post your questions so that we can refer back to them as we go through the presentation. So Kari, go ahead and start your presentation by hitting the screen share and starting that screen share, and I will turn it over to you.
Thank you. Okay, here we go. Can you see my screen?
You're good to go. You're good to go.
Okay, great. Awesome. Okay. Well, as we say, welcome to everyone. We promise that today's presentation is going to be so value-packed that it's going to be worth the time that you've spent in an investment in knowing how to make the best decision for you, your practice, and your future, irregardless of who you are. So we know today that we're attracting people who are ready for change. And so perhaps you're one of those people, or perhaps you're a healthcare professional and you're also ready for a change. So this information is for natural or conventional medicine approaches. And the reason why we say that is because, you see, it doesn't matter whether we're an individual or we're a practitioner. This is the thing that we all share in common. Yes, it's the problem called Obamacare. It's a large pill. It's a big pill to swallow, and it's one that has created a huge political debate. But this is not about politics. This is about solving the Obamacare problem. You see, what we're talking about today is this, is that when Obamacare came into law, people felt confused, they felt perplexed, they were unclear, really lost. And what the purpose of this is to help you sort through all of the confusion so that you're no longer bewildered or left disoriented, so that you have a succinct a plan of action, and you know exactly what it is that your decision is going to be based on the information you receive. So what we're talking about is educating, informing, and empowering. So this isn't a sales presentation, but it's actually to give you the keys to know how to make the right choices in your future. You see, what we want to discuss first of all is what we call the wealth care system. And as this picture illustrates, it seems to be very disproportionate. And really, what are we talking about? Well, let's break it down. You see, first of all, the healthcare system has to do with health insurance. And we take a look at this graph. This is in 2012. Now, if you look at just the 5 largest health insurance companies, their profits were almost $7 billion just in the first 6 months. Now, since Obamacare, how has the picture changed? Well, according to the December 9th, 2014 rpcsenate.gov website, Obamacare, bad for people, good for insurers. And the January 26, 2015 publicintegrity.org website noted, health insurers watch profits soar. So when we look at the Public Integrity website, it makes this profound statement. It says, United Health Group, the largest health insurer, reported last week that it made $10.3 billion in profits in 2014. And it goes on to note that people who have benefited the most financially are the top executives and the shareholders of the health insurance companies. Among 5 of the largest health insurers, being Aetna, Anthem, Cigna, Humana, and United Health Group, Their stocks have gone up an average of 107% in the past 2 years. And that quote comes from mainstreet.com under the article, Obamacare Profits Health Insurance Companies. You see, according to this website, ACA compliant plans are required to include certain benefits. Insurance companies are pricing those benefits into the plan, which means premium increases. In lots of cases, the insurance companies claims liability, but that's not increasing, and that adds to the new profit. Now, just to give you an example of what this means, Obamacare has 10 different criteria, which is the reason why most insurance policies had to be canceled when the law came into effect, because they didn't meet this criteria. So as an example, let's say you're a 40-year-old man and you have to buy an Obamacare penalty or policy, excuse me, or you're a 50-year-old man. Well, what you don't know included in that is maternity coverage. Now, do you see the point? So when we take a look at this, again, this website fills in the blanks. It notes that reimbursements to the practitioners under Obamacare are at bottom dollar lower than Medicare reimbursements, which are already significantly below market rates. So in this example, if private insurance pays $1 for a service, Medicare pays 80 cents, but the ACA exchange plans are paying 60 cents. So really what that means is that a study by the think tank American Action Forum finds that exchange plans are cutting provider reimbursements by up to 40%. You see, doctors are expected to take on more patients to make up for the lost revenue. Primary care doctors already have more patients than they can handle, says the study. And isn't that the truth? How many times do patients feel frustrated because their practitioner spends so little time with them? But this is the reason why, because they're under so much financial pressure from the insurance companies. And so when we look at what Medical Group Management Association noted, it said a 2014 survey comprised of multi-physician medical practices estimates that nearly 250,000 American physicians will not participate in the ACA exchange product. So what that really means is that a person who buys insurance under the ACA Obamacare exchange will not find a doctor. So you're going to pay premiums, but you won't get care. So the study points to two reasons. And the first is that 75% of the patients who had seen a doctor chose a plan with a high deductible. We know that to be the bronze plan. And of course, we've got the bronze or silver, which is a 60 or a 70% coverage. So patients with these high deductibles means that the insurance company doesn't get stuck with anything, and instead the doctor and the patient do. So again, according to CSN News, the Health and Human Services requires that insurers cover customers for an additional 90 days after they've stopped paying their premiums. How does the insurance companies deal with that? Well, they cover the first 30 days, but they say it's up to the doctor to recoup the payments for the last 60 days. So again, when we look at this website, it notes that this is the #1 reason providers are opting to not participate. Currently, about 1 million people have failed to pay their premiums and have had their plans canceled. So where does that leave the doctors? Well, we know. And that's why we look at this picture. It's a little blurry, but it makes the point. It's called medicalopoly. And it's really the government's health care game that they're playing with all of us. And it's obviously part of this wealth care system. And so the ultimate result to those who are affected, practitioner or patient, is frustration, overwhelm, confusion, and just outright overwhelm with what to do. And so what we're talking about here is we're not focusing on the problems. Well, we want to make you aware of them, but what we want you to really know is that change is ahead. Yes, change is here, and it's great news. And what is that change? Well, it's fresh solutions and innovative answers. Albert Einstein is quoted as saying that excuse me, just a minute. Okay, is everyone there? Sorry, I forgot to unplug the phone.
You're good to go.
Okay, great. Thank you. Sorry for that interruption. Okay. Well, anyways, we're talking about innovative answers. And so Albert Einstein is quoted as saying that we cannot solve our problems with the same thinking that we used when we created them. And that's really what we're talking about. Innovative, organic, fresh ideas and thinking that is here to create solutions. And so, whoops, excuse me. And so what we're talking about is, according to the CDC, it notes that chronic disease causes 7 in 10 deaths each year, and 75% of healthcare expenditures treat chronic diseases, many of which are preventable. And that's the reason why we see a shift in people's plan of action when it comes to healthcare, and they recognize that alternative treatments are healthcare. They are far more effective than what they're receiving in the way of managed care, prescription dependency, and all these kinds of things. So if we could shift our health plan to focus on prevention and preventable treatment, or treatment of preventable diseases, wouldn't we have a better health plan model? Well, we believe so. And that's why today we see that, according to the United States Census Bureau, it estimates that there are some 158 million people who self-fund. Oops. Let's go back. And so what we're talking about is that their spending is about $100 billion. So today, that means that there is a decades past due need to not self-fund, but to have a comprehensive health plan. Now, what would that health plan look like? Well, we call it the Obamacare alternative, and it would really be the first time practitioners who provide natural treatments would be reimbursed. We're talking about a health plan where, for a diagnosed condition by an MD, a DO, an ND, a chiropractor, whoever is state licensed that identifies and diagnoses a condition, that natural treatments would be reimbursable for that. We're talking about a health plan where natural treatments, less invasive than conventional, could be used and reimbursed for a diagnosed condition. We're talking about a health plan where natural treatment costs, less than conventional, are reimbursed at full amount. We're talking about a natural treatment health plan that prevents more costly conventional treatments. That's a change for the better. You see, when we look at Obamacare and its natural medicine inclusion, what we see is there's 12 chiro, massage, and acupuncture visits. Anything else in the way of natural medicine is flat out denied. But when we look at the Obamacare alternative for natural medicine, the list is extensive, and it's taking advantage of not the approach by big pharma. We're not talking about that. We're talking about not patented treatments that people who will be exploited and financial gain is the focus. We're talking about treatments that really deal with the whole person and are really part of helping people to reverse preventable diseases early on. Whoops, excuse me. Having problems here. I don't know what happened. Hold on. There we go. Okay. Watch what I'm clicking here.
Looks good.
Okay. Trying to get it to go. There we go. Trying to get it to think and go to the next screen. So, of course, that Obamacare alternative would include conventional medicine, because obviously people will always have a need for conventional medicine, because obviously we have accidents, we have emergencies, we have maternity care, we have things like surgeries and therapy. These are all needed. Emergency admittance to hospitals. These things are all needed, and they would also be included, but they would not be excluded. Or, in other words, we wouldn't have a health plan that would exclude one side of this treatment model versus the other, the way insurance is doing. And so this is a story that I want to share with you now, and it's about the discovery that I made in my life and why this information is important to you, because I want to give you the light of what my life has helped me to discover. You see, I'm a 30-year entrepreneur. I'm also a mother and a grandmother. I've served for decades as a community volunteer. I'm a terminal liver cancer survivor. I'm also a licensed insurance professional. And I became an inventor and a nonprofit founder. And it is all of these things that are going to help you today understand how to best make a decision for your future. This picture is me when I was 25 years old. And what happened is I went to my primary care physician for just a simple physical. I wanted a complete physical, and what I came away with was a terminal liver cancer diagnosis. I was told that I had no time, that there was no chemo radiation that could help my cancer, that I was beyond all medical hope to go home and get my affairs together. And so I was left debilitated, depressed, dying, and devastated. And you can well imagine that no one in their 20s would ever envision themselves being put in this kind of a situation. But to make matters worse, it was this. You see, I was a mother of 3 beautiful little girls, and I know, having not had a mother as a child that was in my life, I know the value of what a mother is, and when her absence is there, I also know the tremendous impact that that creates in a child's life. So not only was my grieving for myself and losing my children, but my grieving was for my children and all the years and how many times and ways that not having their mother there for them would devastate their entire life, the way it has many who've lost their parents too early in life. And so what I did was I prayed. I begged God for a direction, and what I got was this. I got the clarity to realize that I needed to choose to fight for my children. I needed to at least give my children the legacy that their mother did everything she could to make sure she was there for them. And so that is what I did. Now, I had no idea where that choice to fight was going to take me. And what it did was it brought me here. Yes, for the first time, I was brought to alternative medicine, and I found a practitioner, and she helped me to understand my body. But you see, when I came initially to alternative medicine, I had absolutely no preconceived ideas. I had no trust in alternative medicine. I knew nothing about it. And I really felt that, looking back, that sometimes people like to dismiss the effectiveness, the efficacy of alternative medicine and say, well, it's psychosomatic, it's because you want to. But actually, in my case, it's not true, because I clearly had been told it was witchcraft and voodoo, and I was very prejudiced against it, but I was willing to try because I saw no other option. And so my practitioner, she diagnosed my cancer. She obviously also found that I had no time left. My time my clock was ticking, as they say. And but she didn't know anything about the medical test. So when I assured her that I knew, she was relieved. Then she offered me the first glimmer of hope. And that was the fact that she offered me a chance to have the ability to see that there is an opportunity that I have for hope if I am committed and aggressive. And she warned me. And she said, do you have health insurance? And I said, yes. And she said, well, then you're going to have to self-fund this because your insurance won't pay for any of this. And so, having no other options, I accepted the terms of that agreement. And months and months of dedication, nearly a year later, I went back to my primary care physician for follow-up tests, and this is what I found. Boy, oh boy. There we go. This is what I found. Sorry. I found that my cancer was cured. Yes, I was called a miracle. And my cancer was gone because of those alternative treatments. And to the great remiss of my doctor, when I tried to explain to her what I'd been doing, and she did not want to know, she was very clear, she did not want to know what I'd been doing. But she did say that the liver doesn't do for itself what mine had done. So she could accept that it was a miracle of what had happened, of what alternative medicine did for me, but she could not accept that it was alternative medicine that saved my life. And really what that did is it gave me the ability to start realizing that I needed to be more health conscious. I needed to start living healthy and thinking about what I was doing with my life. And so I began that journey. And one of the things that I recognized was that becoming more health responsible meant that I needed to stop realizing that, or go to my doctor every time I had a medical issue. I needed to recognize that that for many doctors, they view preventative medicine as the destruction of their business. And so that's the reason why my medical practitioner was of no support when I tried alternative medicine. And so what I did was also realize that after thousands of dollars of spending, that I needed a financial plan that meant that I did not want to self-fund this ever again should I ever face cancer or any other kind of serious illness. So that began the search for looking for alternative medicine in a health plan. And, well, that was decades of search, and we might call it an exercise in futility. Because, you see, 2 decades I searched for alternative medicine health insurance, and no matter which company I spoke with, the conversation always turned out the same, being that there was no policy, it was a great idea, and if you ever find it, let us know, because we'd like it too. That would be what the agents would usually summarize the conversation with. But it all changed in 2013, and the reason it changed is because in 2013, I became an insurance professional. And when I did, I was able to make the connection as to why my insurance company denied my claims decades earlier. What I came to understand about insurance is that when a policy is written, the policy becomes the law, and the adjusters are the enforcers of that law. So if within that law, if within that policy, there is no inclusion of alternative medicine, then of course it will never be included. No matter how much people beg or plead, it's never going to change. And that's where I decided to take insurance and to write the policy. And so what I did was realizing that we needed to have a way to solve this problem instead of just always looking at it. And so thus, choice, because it is so powerful and it has been so denied people through health insurance, and it is decades past due. Thus, that's where GreenSurance originally came from. We launched July of 2013 as the voice for choice, we called it, the holistic health insurance coverage. And though we didn't have a policy in place yet, what we were doing is market testing this, because insurance is considered to be a needs-based business. So when we identify a need, then we can get a policy underwritten. So that was the original purpose of GreenSurance. Though it wasn't insurance at the time, it was a market test to see if we could get a kind of health-centered insurance policy. And while people found our website and they loved it, the accolades, the excitement people had poured into our website, but so did something else. And that was story after story about how wronged people felt by insurance. And so that's where I really began to realize that ramped up then in October of 2013 when the legislation became effective, and now this forced approach to either penalty or cooperation by the feds. And really, so when I began to look at the Obamacare health insurance policies, what I recognized is there was people, and the media was full of these images of people being interviewed whose policies were being canceled, whose rates were escalating, who were having to absorb huge out-of-pocket co-pays and deductibles in order to even manage the cost, the escalating costs of what their health insurance was turning into. People were making mortgage payments to their health insurance company. And so again, trying to make a connection of how to realize what we should do here. I recognized that GreenSurance was really more than an insurance. It was really about a mission. It was really about a movement. And so what I began to realize is that maybe the problem is the answer. And what I mean by that is this, that when you look at healthcare reform and you look at this code, 26 U.S. Code 5000A, requirement to maintain minimum essential coverage. Under subsection B, healthcare sharing ministry. That's what it's called. And it defines what that means. So it sounds religious. Notice what it is. A healthcare sharing ministry means organization. That's it. That's all it means. And it means that members of an organization who share a common set of ethical beliefs share medical expenses among members in accordance with those beliefs without regard to the state in which the member resides. And what it did was it created, though, this date. You see, it said it had to be in existence at all times since December 31st, 1999. and it had to have been in continuous operation without interruption. Uh-oh. Looks like I'm ready to run out of power. Okay, that's good. We'll stop for a break here. Anyways, and so so this December 31st, 1999 became the date. And the other thing that it meant was that it had to be annually audited by an independent certified public accounting firm. So what that really means is that very few organizations could pass that test. So really, because of all of the caring, thoughtful people that came to GreenSurance, really GreenSurance is about a small group of thoughtful people that have really brought together a lot of talent to maybe not change the corruption and the greed, but to really say that there's got to be another way. And that's what Margaret Mead noted, is that change always happens when caring people get together. And so that's really what the change is all about. That's what we're here to present to you now, is the change. So before we go into what GreenSurance is about and what it does, I'm going to plug in my computer, and we're going to take a break, and we're going to answer any questions that anyone might have at this point.
Okay, good idea. We don't want you to drop off from Hawaii, so get that computer plugged in, Kari. We have a few participants here, but we have no one who has posted any questions yet. So, Clara, I'm going to turn it over to you for a second. If you would unmute yourself, because I think you're a great example of someone who saw the value of it, and I'd really like you to share what kind of questions came up for you when you were first considering GreenSurance and then becoming part of the member of the board of directors.
Yeah, well, my goal as a nutrition therapy practitioner and functional nutritionist is really to let people know they have options. And this was the first time I heard it in this presentation, was they're a policy of choice, and that's huge for me. And I think that letting people know they have options is how I'm going to impact the world of health in a big way. And that's my goal as a professional and a personal goal of mine. And so GreenSurance really empowers individuals with choice by taking that my insurance doesn't cover that out of the equation. And that's a huge business driver for me personally, because I don't take conventional insurance. And so having an answer to that for people who are saying that to me is huge. And so I'm interested. I'm definitely interested in GreenSurance because of that. And I also, the Giving Back Fund is really where I come into GreenSurance as a board member. And it really allows practitioners to fulfill their goals of making a big impact in the health world by giving a portion of their income to people who can't necessarily afford the whole monthly premium of GreenSurance. And it gives them that life-changing option of alternative health care, which is really ultimately going to help our businesses as practitioners. And I'm mostly speaking as a practitioner involved with GreenSurance now, but it's a wonderful option to give back to the alternative health community and ultimately gain more business, because the more people that try alternative health care, the more are going to be convinced, because we all know how well it works, right? And this really has the potential to create this healthcare revolution. And the name of my business is Revolutionary Lifestyle. And I am strongly and passionately involved in this healthcare revolution. And GreenSurance is a huge answer and a huge piece of that healthcare revolution puzzle. And so it has that great potential. And it takes the escalation of costs of conventional insurance out of the equation as well, and allows so many more people to participate in this preventative, holistic care with great guidance. And I don't see any downside of GreenSurance. You know, you have your conventional medicine costs covered when you need, and then you can have these alternative healthcare costs as well. And so, yeah, I really don't see a downside, and I really see it as a huge piece of this revolution of healthcare puzzle. So.
Fabulous. I'm just wondering, as a person who would be taking advantage of it from the patient perspective, how easy is it for both you, the practitioner, and Kari, you want to jump in on this too, but from Clara's perspective, how easy is it for you to convey this as an alternative option for people who come to you who would not have had any kind of coverage for your services up until now?
Yeah, it's super easy. And it's almost, when I first got on the phone with Kari the first time, she actually said, we're kind of trying to create a network of providers because people don't understand that they really can just have any provider, and that's how it works. Like, that was almost, and maybe Kari can speak to that as well, because she was explaining, when she was explaining it to me over the phone, she was like, we kind of want to create this network of healthcare providers just so we have some people to send people to, because they're not really understanding that they can really go anywhere with this health insurance. And that's it, and it's simple as that.
Would you say that this adds another differentiator for you as an alternative healthcare provider who can say, you know, these are the services that I provide, and I also have a means for you to have it covered by a health plan? I would think that would be an added differentiator.
Oh, huge. Yes, of course, of course. And that is, it's so exciting as a healthcare practitioner and as someone who came into the healthcare practicing field as someone who wants to help and not just help certain demographics. I want to help everyone. And so GreenSurance is definitely a differentiator there for me, of course. Mm-hmm.
Great. Kari, do you want to come back in? I'm going to refresh my screen for questions, see if any have come in since I looked at it last. And in the meantime, the two of you go ahead and have your dialogue, and I'll see if there's any other questions from the field.
Thank you. Can you hear me?
Yes.
Oh, yay. Okay. Thank you, Clara. That was awesome information. And really, that's what GreenSurance is about, is we're trying to, again, make a health plan that's workable for everybody, instead of it just being a health plan that works for the elite or the wealthy. But we really want it to be a health plan that is about people, and it's about empowering those people, and it's about giving power back to the providers who are providing, who without them we have no health plan. So it really is a game changer, and it's really about taking this blind off that insurance has tried to put itself in, like it's in such a position that it's as if we have no other alternative besides health insurance, but we do have another alternative, and that's what the law even provisions for. So we're going to use the law to our advantage, and we're going to all benefit by doing so.
Yeah, wonderful. So exciting.
I found it really interesting that what you were talking about early on about Obamacare. Now, this is new information.
Yes.
And, you know, that what you're talking about is that so many people, especially with these high deductible plans, don't look like they're going to really end up with much coverage at all, or they won't be able to find a doctor who will cover them, because it sounds like the doctor is going to take a financial hit on some of these. Did
That's
I
right.
understand that correctly?
You understand it exactly correctly, and that's the problem. So let's say that you comply with the law and you buy health insurance, and I've had this conversation with multiple people already, and they've said, well, you know, I bought this Blue Cross Blue Shield policy, but I can't find any practitioners that'll take me. And this is the reason why. We're trying to help people understand why, even if you're going in-network, why you're not finding practitioners that will cooperate with your health insurance. It's because the insurance companies are squeezing the doctors so that they're profiting, and the doctors are being left with the crumbs. And how rotten is that? So again, when we're distilling this down and we're taking out the greedy component that health insurance represents in all this, and we're just putting it back between the people and the practitioners. See, we can all have a better health plan in all of this by doing that.
I love it. I just think it's such a revolutionary concept that, you know what, it's like anything that's new. Yes, what you're doing and sharing this information and getting it out there is to help people, you know, start thinking out of the box as far as their health coverage is concerned.
That's right.
Realize that there's more than one way to go about this. And I was busy monitoring a lot of things. So did I miss the cost to do this, both from a healthcare provider standpoint and from a patient standpoint? Did you go over any of that?
I have not. That's in the next segment. Thank you for asking.
Okay. Well, at this point, the questions aren't coming in. Come on, you people. I know you've got questions. We've got the comment section there for you. So I know there's a few of you there live. So go ahead and let us know if you've got a personal question. If not, we'll let Kari go ahead with the next segment of the presentation.
Okay. Well, I'll take it over here. Okay.
All right.
So let's go back to our screen share. And we'll go back. There we go. Can you see it now? Can you see the change?
You're good to go.
Okay, great. Okay, so if change is what you're interested in and change is what you're ready for, then we've got great news because change is here. You see, what GreenSurance is, and you can see that this is a culmination of many different people. So it's not about any one person, but there's a lot of talented people that have come together. And what we're talking about is this community effort of how to create something that actually works for everybody. And so because Clara is the newest, we don't have her picture in here yet, so I apologize for that, Clara. But anyways, but you can see that there's a lot of people that are involved directly. And really what happened was is that looking for a fresh change and a fresh, innovative, organic solution to this big quagmire of problems that Obamacare was causing, and recognizing that there was that caveat to the law, is that when I started doing more research, I recognized that there was a thing called cost sharing, and that's what that mentioned. The law mentioned a cost sharing ministry. So cost sharing as an organization actually has been used, though unknown to most people, for over 30 years. And there actually had been some 500,000 people involved in cost sharing. And that cumulative effort had paid out over $1.3 billion in conventional medicine costs. So realizing that we're not reinventing the wheel here, but what we're doing is we're going to put a new spin, put something even better on something that actually is working. And so looking for organizations that could meet that narrow criteria, what I found was that while many were in existence before the law, most could not withstand that criteria. And so for one reason or another, and I would suspect that most of it had to do with the 1999 issue, that they folded. But what I was able to find is there were some that did qualify. And so what I did was I reached out to one in particular who had began in 1988. There's actually a couple of them that actually we're working with right now, but one in particular. It began in 1988, so they were well within the deadline, and they had cumulatively paid out tens of millions of dollars to thousands of providers for conventional medicine. And so what I did was I presented to them what my vision was in this new day of healthcare. I presented to them what GreenSurance, what the message was about, that the alternative for alternative healthcare. And the result was that this cost-sharing organization was 50,000 members, and they put it to a vote, and they came back with a 94% approval. Well, that was great news for all of us, because what that did is then that gave us the ability to create a nonprofit coalition. And so today, GreenSurance has multiple nonprofits all working together and trying to really give people, hold the light, and give them the way out of the darkness. And that's why we call this health plan freedom. And we believe that once you understand what this is, that you'll feel that it's the last health plan you'll ever need. So no more will there be confusion. And as Clara mentioned earlier, see, our goal here is to take "it's not covered by my health insurance" out of this conversation. And isn't it true when you think about all the people who have sadly lost their lives that even may have chosen natural treatments, but maybe they ran out of money. And when they ran out of money, then they ran out of options. And when they ran out of options, they were forced into toxic treatments. Why? Because their health insurance would not provide natural treatments. Well, folks, that is a day that is now a moot point. That conversation, we can take that out of our conversations, because you see what GreenSurance is about is shattering this barrier that insurance has created between conventional and alternative. And so what we are is we're a symbiotic healthcare plan. Symbiotic, that means everybody benefits. And that's why you heard earlier the term the win-win-win. That's really what this is. Everybody, practitioners and the patients alike are all benefiting, as well as the co-op. Everybody's benefiting in this well-oiled machine. And because we believe that choice is powerful medicine, that choice should include conventional or natural health care. And that's what GreenSurance is about. It's about natural medicine health care because choice is important to people. It dignifies them. Now, while it seems a little ambiguous, people don't really understand what cost sharing is, it's really, we want to talk about the fact that the focus here is not on profits. And we know that insurance is a profit-driven industry, and that's always the bottom line. But when we're talking about a self-funded health plan, see, we're independent of health insurance, and that's why we have a different vocabulary, if you've noticed, too. We don't call it coverage, we call it benefits, and those are just some of the differences. But here's what you have to think about. The difference between a credit union and a bank, okay? They perform the same services, but they do so with a different method. And that's the difference between cost sharing and health insurance. See, both cost sharing and credit unions are member-run and member-owned organizations, and that's what we're talking about, taking ownership in your healthcare plan. And while this is an image that's all too familiar to practitioners and patients alike, denied, rejected treatments coverage, well, GreenSurance provides far more for far less. You see, we are the penalty-free alternative. We're the exemption. There is no penalty. In fact, I just read some information that said that anyone who enrolled in a cost-sharing organization anytime during 2014 were exempted from the whole year. And when you're talking about, here we are in August, and so people that come into the co-op anytime from September on are going to be given the same exemption from the penalty that you got if you signed up in January or February. Is great news, because when it comes to health insurance, that's not what happens. The month that you enroll in health insurance, all the months you were not enrolled is when you pay a penalty for. So that's why we call it the best alternative, because it's the alternative for natural and conventional medicine. Now the question comes up, so how extensive is this? This is just Hawaii. This is often what people think, but actually that's not the case. GreenSurance is a national health plan, and what we do is we provide a health plan benefit to each member that's $1 million per incident. That's not per lifetime, that's not per person, but that's per incident. $1 million. That buys a whole lot of health care, folks. And so what we really want you to understand is that this is about a simplified payment solution. Wouldn't that be nice for a change? And that comes through one of our partners called Global Care. And for practitioners who are conventional, they may have heard of Global Care, where naturopaths may not be. But really what Global Care does is it gives us the ability to do provider reimbursements in a timely 14 to 30 days. Yes, that's what the Global Care advantage here is. And when you look at conventional health insurance and we look at Medicare and Medicaid, what are doctors facing? Conventional doctors are facing 90 to 180 day delays, and even denied coverages or denied reimbursements, and they have to, have entire insurance billing departments devoted just to recuperation of their time dollar exchange. So when we're talking about this new day in healthcare, we're talking about natural treatments that are reimbursed for the first time. And when you think about the earlier screen where we talked about the Obamacare alternative, what that would look like, that would be where natural practitioners are reimbursed for the amount based on, as long as it's comparable to and less than conventional medicine. And so really, what a game-changing opportunity this is. So the question for conventional practitioners is, how much am I reimbursed? Well, we've got great news. Because conventional practitioners receive 150 to 170% of Medicare. And if you think back to the ACA plans, why practitioners don't want to participate, this is double to triple the reimbursement. So do you see why practitioners will always be happy to cooperate with a GreenSurance co-op member, and why practitioners are eager to participate in what we're talking about here? You see, GreenSurance is about providing, as Clara mentioned earlier, is that while any practitioner can be reimbursed by the co-op, what we are incentivizing practitioners to do is to come on board today and to become a network provider. And the way that we're giving you those bonuses is to pass on our negotiated rate for all of your credit card transactions of 1.6%. Now that's significantly lower than what most practitioners are paying. And really, what we're building here is a proprietary payment system exclusive to our network providers. And the advantage of coming on as a network provider, another advantage, another unique advantage, is that our members will soon have access to be able to site search our website. And what they'll do is they'll be able to find our network providers so that you have free access to new business of co-op member patients. And so it's a great opportunity because we believe that healthy people are happy people, and we believe that healthy bottom lines for practitioners are happy practitioners as well. Uh-oh. Wrong button. Okay, here we go. So if you love GreenSurance and you love what you're hearing, then this is the simple answer. You can refer, after you sign up as a practitioner, your patients to GreenSurance. And it's very simple. You see, all they do is go online to mygreensurance.org and they can click enroll. Now, if you look at the comparison of GreenSurance to just typical health insurance, where today in health insurance is anybody going to find a comprehensive health care plan as a single person with an annual spend for everything of less than $4,100 for the annual cost, or a married couple of $5,800, or even a family, irregardless of how many children there are, of $6,300. That's it, folks. This is the total annual cost. So the question is, how does your health insurance plan compare? Well, considering the fact that today people's deductibles are $5,000 and $10,000, I think the answer is pretty obvious. And really what we want to do here is we want state licensed practitioners who become the primary care providers for our member co-op, MDs, DOs, NDs, chiropractors, to focus on optimum patient care. How often do people find themselves frustrated when they go to the doctor and they get maybe 5 minutes of the doctor's time, and not recognizing that the pressure the doctors are being put under by the health insurance companies? Well, see, we're eliminating that, again, that problem in this equation. So you went into the healthcare field because you care about people and you want to provide the way to help people help themselves. Well, that's what we're here to help you do. So our provider enrollment is a simple two-step enrollment process, and it's on our website. If you go to mygreensurance.org and you look under the provider section on the menu, what you'll see is it's two simple steps, and it costs nothing to enroll as a provider. And the idea is that we want to drive down your cost of business as a practitioner, and we want to increase your profit margins, because we know that that's how a working healthcare plan should work. It should work for the benefit of everyone involved. In fact, what we're looking at here is improved provider payment solutions. We're talking about prompt reimbursements, end payment hassles, resolve self-pay patient troubles. In fact, with this health plan, what we're talking about is eliminating the need for self-pay. On-time reimbursements to the practitioner, reimbursements without insurance to the practitioner, reimbursements without extra staff for the practitioner, and no outstanding accounts receivable. So we're talking the 60, 90, 180-day account receivables. See, those simply are not necessary. And there's no collection expense for copay. So because we don't have a copay, there's nothing for you to collect. So when the patient account is settled with the practitioner, it's settled in full. And again, the question comes, people ask, do we have to have malpractice? Well, that is a personal choice, but the co-op requires no mandatory malpractice insurance. And this is the other thing. Once a person has a diagnosis from their primary care physician, and they have a plan of action, and that is pre-approved, then all of the treatment costs for that plan of action are never denied. That's very big. So we want to make sure that practitioners understand that. And so what we're saying here is it's a unified payment system. And as we mentioned earlier, all card transactions are processed at a 1.6% plus a low monthly fee. And what that does is it does this. It's going to give you access to our proprietary payment system, whereby the goal is to speed up the 14 to 30 days to an even smaller window for reimbursements for our network providers. So we invite now practitioners to get listed. We invite you to join us. You see, it's a free network provider enrollment. It's a free merchant processor enrollment, and it's exclusive only to network providers who get the benefits that GreenSurance offers. And so, whether you're a network provider or you're a co-op member, the choice is yours. And that's what GreenSurance is here to give you, is the power of choice. Now, the next issue is this. The reality check is that maybe some are listening to this webinar and they're still left undecided. Let's take a look at what the Daily Caller News Foundation of August 8th, 2015 has to say under its article, everybody has to pay this new Obamacare tax. So let's say that this is for the people who are in compliance, who do have health insurance. What happens? All Americans who bought health insurance policies this year face a 41% increase in excise taxes because of hidden fees contained in the obscure section of the Affordable Health Care Act. This year's tax will cost individuals more than $500 just in extra premiums and $700 for a family. A 41% sticker shock increase doesn't stop in 2015. Over the next 4 years, the statutorily mandated Obamacare fees are expected to double again, and the levy will continue to go up each and every year into the future. The tax was buried in Section 9010 of the law as a ways to raise future funds to pay for this legislation. Senator John Barrasso said, the tax is another example of how the president's health care law was designed, so the most painful parts of it would kick in years later, and where's he going to be? Yeah, obviously we know. See, the only group exempted are those who self-insure, and that's why a self-insurance system where no insurance company is used is the way out. So what we are here to say is that the Affordable Health Care Act is not your only option. You do have a choice. And we want you to exercise your right to choice by joining us at mygreensurance.org. And so now we'll stop the PowerPoint and we'll open it back up to any questions that anyone may have. And let's see here, Virginia, let me try to get back to you. And Claire?
Not a problem. You're doing good. You still have to click stop presentation so we can see your beautiful face instead.
Oh,
there she is. There
it is. Thank
you. Claire had to leave us, and she said she will be back for tomorrow's presentation, which is terrific because I think it's great to have the perspective of a healthcare provider in all of this. I have asked for questions, and we have a shy audience today. So either you've done such a great job presenting all of this and getting really the nitty-gritty out there, or they just need a chance to really mull over it. Or for those of you who watch this in replay mode, you know there is going to be an email sent to those who registered who did not get to watch it live. We want to thank you for also taking the time to really soak in this information, because I think it can be life-changing personally and for all the healthcare professionals out there. I had a couple questions come up, though, so how about if I run those by you, Kari?
Awesome.
How about for the practitioners from a paperwork standpoint? Now, you said that the conventional practitioners are going to get 100 to 150 to 100% increase above what, above what Medicare payments are.
Right. So, well, the increase would be 50 to 70%. It's 100% of Medicare plus 50 to 70% more. So that's what that is. So the way it happens is they bill electronically, and that's how they end the paperwork nightmare. So Global Care is where the electronic bills are submitted to, and then that's where the reimbursements come from because they are the payer.
Well, this could be a huge savings even for traditional healthcare providers, because
Yes.
I know that they have to they have mountains of paperwork, and I generally have to hire 1 or 2 people just to deal with healthcare claims.
That's right.
So,
And some of them have an entire staff or department just to deal with all of the recycling that they have to fight with insurance, the coding, et cetera, and so forth, because everything is so problematic. But that's where when we do, like, especially when we're doing pre-approved treatments. So, like, for instance, you can go to your primary care physician and you don't need a pre-approval for that. You can go to a hospital for emergency treatments. You don't need pre-approval for that. But when you're coming to like a diagnosis and a plan of action, those are pre-approved. And so that's really how you simplify all of that and make it more streamlined, so that the practitioner just submits the electronic invoice because it's already been pre-approved and the payment is issued.
oh, so simple. And then when you're talking about 15 or 14 to 30 day reimbursement time frame versus,
Right.
what did you say, up to 90 days? I mean, that's
Well, conventional insurance is 90 and Medicare is 180. So yeah, it's time
Wow.
is money, folks,
Yeah.
right? And we've got to realize that. And that's why these practitioners have got a lot going out. And when payments are so slow coming back, well, you can see that that's financially not making sense for them. It's not a way to keep your practitioner happy and keep them involved in patient care. And that's really what we're saying here. These practitioners didn't go into medicine or into healthcare treatments to fight with an insurance company. They came to give patient care, and somehow that all got lost in all of this. And we're here to say that it doesn't have to be like that any longer.
Oh, I think it's just such a phenomenal, inspirational, that's one of my favorite words, inspiring, revolutionary concept. So I'm just so pleased to be able to help bring this out to public awareness. Let me check one more time, see if we have any other questions that have come in. Otherwise, Kari, do you have some final thoughts as I go ahead and check?
Well, I guess the final thoughts is, if you have any questions, please feel free to go to our website. We'll answer any questions that you may have. And obviously, we can't answer all the questions at one time on this presentation, but we feel like we've covered a lot of ground, and we hope that it helps you to clearly make a decision based on information and facts, instead of just being forced to do something and not really understanding the ramifications of what you're doing.
Terrific. So you all know you can go to mygreensurance.org, and it's a simple, free 2-step process to get registered as a health professional. So very exciting. And we will have a couple more presentations coming up this week. So if you know of anybody else who might want this information, or needs this information, absolutely send them our way. Kari, what would be a good email address for them to reach you if they wanted to see one of these presentations?
They can reach me direct at kg@mygreensurance.com.
Okay, that's for Kari Gray, kg@mygreensurance.com. Let us know if you have someone else who would like to watch this. There's also the links that you've received in your emails, and you can send them to a registration page, and they can get onto the broadcast, watch it live or in replay mode. So Kari, thank you so much for this really, I think, vital information that could be life-changing for both healthcare practitioners and their patients. Thank you so much.
Virginia. Appreciate it.
All right. Thank you, everyone, for being here today. You have a terrific week. Bye-bye now.